Hi, my name is Jerry Hesch, and I'm with the Hesch Institute in Henderson, Nevada. This is part 2 of a few questionable sacroiliac mobility tests. And there it is, part 2. And this is presented to you from the Hesch Institute. Our website is heschinstitute.com, spelled H-E-S like Sam, C-H. The Hesch Institute is in Henderson, Nevada, very close to Las Vegas, Nevada, and we do consultation and treatment for complex sacroiliac joint dysfunction within a whole body approach. And rather than name pain or movement, faulty movement patterns and posture in the pelvis as sacroiliac joint dysfunction, in truth, it's part of a whole body system, and certainly the lumbar spine, the mechanics of the pelvis separate from the sacroiliac joint. The hip joint, lower extremity, influences it, and the preferred term over the term sacroiliac joint dysfunction is lumbopelvic hip mobility dysfunction. I think that's a much more accurate. It opens up our thinking to think of multiple structures and screen multiple structures rather than focusing only on one small paradigm and blaming everything on one structure. And again, this is part 2. It's a continuation of the concepts that we briefly introduced in part 1. And so I'm not going to belabor the fact as we look at parts 2 and 3 and maybe even part 4. There's another test. I'll bring Missy over here. And there is another test called the forward flexion test, and you can stand sideways. And in this exam, the clinician, again, palpates the PSISs and has her forward bend comfortably as far as she can go comfortably and come back up. Missy does yoga. She's very, very flexible. And again, the clinician is looking for one side that moves too much, and the interpretation is purportedly that means that the sacroiliac joint is stuck on that side. But again, if you want to do this test one more time, there are far too many assumptions. Number one, come back up please, the assumption being that the height of the pelvis is normal on both sides. And we can screen that, but it takes different postural context, including sitting, to make that discernment. She could have 2 different hip joints such that the mobility is different when she goes towards flexion, especially towards end range. She could have issues with mobility in the knee joint. She could have issues with mobility in one ankle or subtalar joint, the joint below the ankle, or the foot and ankle, multiple joints, 26 or more. I believe the correct number is 27, counting, I'm not going to elaborate too much on that, but there's 26 bones, 27 joints in the foot and ankle complex per most authors, and many muscles that participate. Now again, realize that in this context, she initiates flexion in the upper cervical. So go down slowly, or some people initiate it in the neck, come back up, and I want you to look down first. Okay. Good, so she's initiating in the neck first, okay, then the thoracic spine, movement continues down into the lumbar spine, and come back up. So if we were to ignore influences of the lower body, we still have to consider influences of the upper body above the sacroiliac joint. Now, Missy's lumbar tone feels rather equal. Can you bend forward just part way? Okay, stop there please. She has much greater tone in the right lumbar paraspinals. I sincerely believe that alone would impact the quality of this test. Come back up. So one point that I'm making is that these tests have a very low inter-tester reliability. We could bring another clinician, have him do the same test, and he and I may disagree, he and she may not agree on the very same test. Again, these tests don't isolate movement inside the sacroiliac joint, but that's the message that is implied many, many times. It is a gross movement test, and it does not and cannot isolate the SI joint, and that's based on very good research using a technique called stereophotogrammetry and using balls of titanium that were inserted into bones throughout the pelvis, throughout the sacrum, the ilium, etc. And so this is a second test that is very questionable, and I think that we've communicated the main concept. Thank you very much.